Our CNA is marking its 25th anniversary this month, and so we're taking the opportunity to look ahead to the next quarter century here in Asia. Yesterday, we focused on business and work. Today, we look at how Asia is primed for rapid healthcare change due to shifting demographics. CNA's Chan Yu-im is our lead editor on this project.
We're going to three places which we think cover the key health issues that will really impact the lives of people in Asia for the long term. In India, it's about how the country will rise to the healthcare challenge of taking care of its 1.4 billion people. And then to the Philippines, where COVID-19 exposed gaps in its healthcare system and what ASEAN needs to do to respond to the next big public health emergency. To start off, we'll focus on aging societies. Michio Ishida tells us how Japan is addressing gaps and managing its silver transition.
Japan is one of the world's fastest aging countries. Seniors 65 and older make up close to 30% of its population. Estimates put the number at 40% by 2070, meaning the strain on the healthcare system will become more acute. Taichi Ono is the Director of Healthcare Policy course at the National Graduate Institute for Policy Studies.
Elderly people are per capita use of the healthcare resources higher compared to the younger generation. The analysis made by the Ministry of Health tells about the 1% increase is contributed by the aging of the population. But at the same time, our total population is decreasing. That is partially offsetting such an increase of the elderly people.
Reforms to the healthcare system are underway to ensure sustainability. Residents of Japan enroll in mandatory health insurance and access medical services at affordable prices. Low-income seniors aged 70 and older used to copay just 10% of their hospital bill. But this was changed in 2022, so seniors who earn more pay more. Beyond acute care, Japan is also placing greater emphasis on long-term care. After the age of 40, residents of Japan must pay into the nursing care scheme. That's on top of the healthcare insurance coverage. This supports the fast-aging population. But there is more Japan needs to do to be able to support the healthcare of the elderly population. Professor Ono, who worked with the Health Ministry for about 30 years, says demand for long-term care is expected to increase for at least 2 or 3 decades.
Services are provided both in the institution like the nursing homes or your own home by visiting the nurses or visiting the home helpers or going to the daycare services. Currently, 1 in every 8 people are engaging in health and welfare sector. But in 20 years or so, it should be 1 in every 5 people.
Japan has more than 15,000 private elderly care homes, according to authorities. But the sector suffers from severe shortage of caregivers. While it wants to bring in more foreign workers, Professor Ono thinks this will be difficult, as average wages lag behind those of other developed countries. So Japan is investing in robotic care devices as a solution.
The reward is to reduce the burden of the caregiver workers. Such kind of innovation is taking place, although not so rapidly. I think the low-tech technology is the one thing that we need to explore more.
About 8 in 10 care facilities do not use robots, according to a nationwide survey of nursing care service providers. Analysts say the cost and lack of skill among staff to use and maintain the technology are hurdles to adoption that will need to be overcome. With average life expectancy at 84.5 years, younger Japanese have concerns about how the healthcare system can support their needs as they age.
If care facilities are well equipped, I would like to be admitted. I don't think it's possible for my children to look after me.
I think we will have to pay more. Aging will advance, medicine will advance, life will become longer.
The government will have to find a way to ensure this group is cared for in its golden years, even as birth rates fall to record lows. Michio Ishida, CNA, Tokyo.
53-year-old Sanjay lives in an urban slum on the outskirts of New Delhi. A few years ago, he delayed seeking treatment despite being severely ill.
I needed someone to carry me to the hospital. They had to run around for hours to even be able to see a doctor.
Getting access to healthcare in India can be time-consuming and expensive. Those who want free or subsidized treatments at public hospitals sometimes have to wait for months, if not years. Sanjay eventually went to the hospital when his condition worsened and he was diagnosed with tuberculosis or TB. He took months to recover, and all the while government volunteers had to make sure he stayed the course. That's because rural and poor communities lack awareness about preventive healthcare practices. This is Preeti Sharma, a community healthcare volunteer.
There's stigma surrounding TB. Neighbors will tell them the medicines have made you sicker. You won't get cured. Many times patients agree to stop taking their medicines, so we keep in close touch with them and make sure they recover.
One person dies of tuberculosis every 2 minutes in India. It's one of the country's most pressing healthcare challenges. The disease is curable and India wants to eradicate it by next year. But doctors and frontline workers say that the fight to stamp out TB is plagued by the same problem that overburdens India's public healthcare system: the urgent need for more doctors. It's a shortage that is reaching crucial levels, especially since India is now the world's most populous nation, further stretching an already fragile medical system. Data shows staffing levels of doctors in rural India is at just 20% of capacity in some categories. The government says India has one doctor for 834 patients, well above the recommended WHO level. But the figure includes those who practice traditional medicine not recognized by UN agencies. To improve patient care, the healthcare sector is turning to technology. Doctors say telemedicine has been a game changer in a country as vast as India. This hospital, for example, brings together physicians, field leaders, patient counselors, and community health workers in the virtual space. They discuss best practice treatments to guide doctors in rural areas. Dr. Shalini Puri is a medical officer at the Ramakrishna Mission Hospital in Delhi.
Accessibility to bigger hospital is very less over rural health and urban place. So sometimes they have all the equipment, but they don't have the knowledge.
The government has built more than a dozen specialized institutes in the last 10 years, and there are plans for every Indian district to have at least one major government hospital. But looking to the decades ahead, experts say a sustainable way to expand healthcare access is to bridge the gap between private and state care. Dr. Rajiv Agarwal is the Vice President of the Association of Medical Consultants in Mumbai.
Where the government land is given, it is developed by the government and it is given to private, for catering to the poor patients without taking any money. If the government is able to capitalize this pan-India, we will be able to get quality treatment to the patients. Scope of the medical industry is very, very bright in the next 10 years. We are living up with the expectations of the developed countries also. The very fact that developed countries are sending their patients to us, because the cost of medical treatment is so high, they're almost 10 times more than what it is incurred in India or developing countries.
Currently, the government's public healthcare expenditure is one of the lowest in the world. Experts say India must raise its healthcare budget if it wants to realize its mission of making healthcare accessible and affordable for all. Neha Punia, CNA, New Delhi.
It's been a year year since the end of the COVID-19 global health emergency, but the Philippines is now taking on a different battle. Health inequities exposed by the outbreak. The family of 17-year-old Cyrus Lescano knows this all too well. They spent months in a hospital after he got infected with a disease. The state health insurance covered only 2% of their $22,000 hospital bill. They are now deep in debt due to a medical loan. To pay it off, his father Claro is working as a house painter. And the land title for his relative's home serves as collateral for the loan.
I've computed my daily salary and the loan I need to pay for the hospital bill. 1 week of my salary is equivalent to just 1 day of hospital room fees. My salary is inadequate.
This is a common story among many Filipinos. Health specialists say a lower middle-income country such as the Philippines can only afford to cover the healthcare expenses of the poorest of the poor. This means medical bills are impoverishing even for the working class. Experts say preventive care and early diagnosis are key to reducing healthcare costs. Michael Caampued is the president of the Philippine Society of Public Health Physicians.
Let's fund more primary care facilities because it's cheaper. It provides more preventive and primary care interventions, and then everybody has a chance to be covered. And up until a time that we achieve a level of productivity or economy for the country, then we expand our care.
As of 2022, only 21% of Philippine provinces had adequate primary care facilities, according to the Department of Health. The Health Secretary's plan is to build 28 primary and urgent care multi-specialty centers, dubbed Bukas, to sound like the Filipino word for open, by 2028. They're designed for the 28 million poorest Filipinos. The first such facility opened in early March. Doctors I spoke to say this so-called Bukas facility closes the healthcare gap between village-based health centers and tertiary hospitals. It has equipment and offers services not typically done in rural health centers, such as minor surgeries for patients not needing hospital admission. Officials say such centers can easily be converted to isolation facilities if there is another pandemic. Albert Domingo is the Philippines' Assistant Secretary of Health.
So the number of COVID-19 dedicated beds can easily be increased upon instructions from the DOH should there be another pathogen. So we don't call it COVID-19 anymore, just call it Disease X. Disease X beds can be increased in terms of number based on the accordion plans that the hospitals have.
But while the world prepares for Disease X, the Philippines is lagging behind its ASEAN neighbors such as Singapore, Thailand, and Malaysia in terms of basic health services. The price of essential medicines is also an issue. Drug costs are more than 3 times higher than in other countries. One survey found that many Filipinos end up not buying their prescription drugs due to the high fees. Financing health reforms requires external help. ASEAN has set terms for a regional reserve of medical supplies for future public health emergencies. But when it comes to vaccines and other life-saving medicines, inequities persist across the bloc. As the world prepares for the next pandemic, ASEAN's commitment to building regional health capacity in the years ahead is also expected to be an investment in its economic security. Buena Bernal, CNA, Metro Manila.
Digital health is a burgeoning market in this region. Estimates vary, but one projection is it will be worth $1.5 trillion by 2030. Another Citigroup report says the scale and penetration of digital healthcare in Asia is significant, reaching some 1.5 billion people and growing very fast. I think it used to be one of those things that no one took seriously until COVID, and now many of us are very familiar with telemedicine and video consults. The pandemic also exposed exposed cracks in health systems worldwide, but since then it's changed the way that we access medical services and how governments organize health systems. Asia is also staring down the barrel of rapid healthcare change because of shifting demographics. Aging and shrinking populations will have implications for economic growth. Countries like Japan, South Korea and Singapore are aging, and they have the double whammy of low fertility rates as well. So tomorrow we'll look at sustainability and the climate. We'll explore Singapore's green energy ambitions in the coming decades as it looks to decarbonize its energy sources. Also, how developing economies such as Vietnam are building a greener economy to sustain its manufacturing ambitions. And then Malaysia to explore the challenges of developing a national climate adaptation plan that can gain the trust of communities already battered by extreme weather events.